I'm Dr. Ekerete Francis Ekpo. I hail from Akwa Ibom State, although interestingly I was born in Lagos State many years ago. One might wonder initially what I'm doing in Plateau State. I actually schooled in University of Jos, graduated from the highly prestigious University of Jos, and went on to serve in Ekiti State, and then came back to Plateau State. I've always wanted to work in Plateau State. Having schooled in Plateau State, encountered the weather, serenity of environment generally about Plateau State. It's not a surprise that I planned to return, and I did return to work in Plateau State. I'm currently working with Plateau State Hospital Management Board, posted to General Function. I like to say that I've always been fascinated with health generally and the human body. In fact, my initial interest in health had more to do with animal, medicine sort of thing than with human medicine. Okay, we had pets then growing up. We had dogs, so I was interested in how to keep them healthy. So at the time, I even learned how to recognize some of their diseases and then treat some of them, especially worm infestations. But my interest as a child was more with technology, engineering. Close to, after I'd graduated from secondary school, I started picking more interest in medicine, reading a lot of journals, because at the time my dad used to bring journals home, and so I read a lot of them, and I thought it was something fascinating. I thought that studying medicine could afford one the opportunity to be able to treat sick people, diseases, cure some of the diseases, maybe even find cures for all diseases. And the turning point for me was after watching an interview of the Nigerian doctor who claimed to have found a cure for HIV at the time. And I became fascinated with HIV, and I started studying, reading up on HIV, and I realized it was something, then a pandemic, and then an epidemic. Yes, it was a child's dream, but it was a dream, okay, because here we are more than 20 years later and there is no cure for HIV. But that was the turning point for me to have the opportunity to learn about diseases and try to find, not just find cures for them, but to be able to administer available cures and treatments, to alleviate the various sick conditions of people that I will encounter, as I go on. General Function is arguably in a rural area. Of course, we don't like talking about rural areas, in this part. And it was by chance that I was posted here. Okay, so it's not like I chose to come to Function, but having been told, that I'll be posted to a rural area, there wasn't much preparation I had to make, because I've been exposed to rural community and kind of medicine before during my NYSC, where I was posted to Emure General Hospital in Ekiti State. Coming here, you'll find very notable challenges regarding infrastructure that are not only limited to the hospital or medical or health related infrastructure within the facility of the hospital, but also, or rather more so, government-related infrastructure, like public facilities or public infrastructure like electricity, roads, access to water, and things like that, even housing. So ahead of time, of course, previous governments had laid the foundation. So in the hospital, for example, we have generators on standby for standby electricity. We have water supply, independent water supply, through a borehole that is solar powered. Of course, from time to time, they've had to undergo some repairs and things like that, because being in a rural setting, we are naked with regards to security, and so some of these things are exposed to vandalism, and so from time to time we've had to repair them. Now that's regarding infrastructure. Now, being a rural hospital, we find that not many people want to work in a rural setting, so we suffer a lot of personnel challenges, where we don't have as many workers as we would. Now, of course, we are aware that the whole country, there is a paucity of health workers in the country. We have people leaving the country trying to japa, as they call it now. So that affects the number of people that are available to be employed, right? However, among the little number that gets employed, you have people not really wanting to get posted to function, and even when they are posted to function, they don't want to come to function. It's a rural area, you don't have access to even groceries the way you would if you were in Jos, for example. So the standard of living may not be something a lot of people will want to subject themselves to. So we end up having less number of staff than we should. And then, of course, I think that not to cast any blame in particular, but we find that the rural hospitals tend to be less funded because people assume that it's a rural setting, and so they don't want to spend money on it. So we lack certain hospital infrastructure. So certain things that, for example, you'd know to do as a doctor to alleviate or ameliorate the illness of your patient, you are unable to do because you don't have, those materials available to you. So those are some of the challenges that we actually encounter here. State of health in Nigeria is poor. It's it largely stems from the top, where we have that despite having agreed to an accord, some 20 years ago, where it was agreed that about 25% or so of the national budget will be dedicated to health, sponsoring health. We still have that, we are still less than 10% in Nigeria. So that's like a general problem in the country. So health receives very poor funding. And so even though a lot of things to do, or you have a lot of things to do, there isn't fund to get them done. You don't have the money to make it happen. You don't have the resources to make it happen because already the budget is poor. That's one. So and then more so in the rural setting. Regarding health, health is actually the business of everybody. You should have government and the public, the citizens collaborating and all that. But we find that is not the case here. And maybe because health is something that is not exactly hammered upon. We have people generally living in neglect of their health. And so they don't think they should look forward to getting involved, in health generally. Otherwise, we should have, well-placed members of society, coming, for example, paying visits, for example, to find out, what is happening in the hospitals within their vicinity, for example, whether they be government hospitals, private hospitals, at least know what is happening and the kind of services that your people are accessing. But we don't have that. So I would like to say that the state of things mainly continues to be this way because of the general nonchalance that the citizens have or give, concerning, healthcare. The government is playing, its role. Okay. Now, of course, we're talking about maybe increasing their participation. We're talking about maybe increasing their financial participation, their financial commitment towards, that. But they are playing the role. Okay, government has in place various interventions at various levels. We have interventions at tertiary level, we have interventions at secondary level, we have interventions at primary level. We have teaching hospitals, federal medical centers, like that. And then we also have some research institutes. Okay, we have the IHVN, for example, we have the NVRI. Okay, so these are interventions actually of government at that level. And then at state level, we have the establishments of specialist hospitals. For example, in Plateau State, we have the Plateau State Specialist Hospital. We have various general hospitals. In fact, currently we have general hospitals in every local government of the state. We have in some local governments rather, there are even 2 hospitals, owned by the state governments. For example, Pangshin has General Hospital Pangshin and has Cottage Hospital Jerok. So these are interventions, right? And then apart from the general hospitals and cottage hospitals, we have also primary health centers scattered all across the country. And if I may limit it to Plateau State, we have hundreds of primary health centers in the state. So these things exist. Like I mentioned earlier, there is a general non-challenge of the public. So a lot of people are not even aware that these interventions exist. A lot of people are not aware that there are primary health centers in their local governments. There is no local government in Nigeria that has less than 10 primary health centers. Okay, and these primary health centers serve as feeders to the general hospitals or cottage hospitals, within or around them, rather. So there are interventions already on the side of government. And we have also interventions from NGO, notably in Plateau State, we have APIN, that's regarding HIV in particular. We have KNCV regarding TB. We also know APIN partners with government to sponsor TB programs. Okay, so these are interventions that exist. And going by the WHO recommendations, okay, in Nigeria, government is actually trying. Okay, the only problem that we have is they need to do more. Okay, government needs to position people who have demonstrated not just skill, not just having demonstrable knowledge, but they have demonstrated passion towards ensuring that health services are delivered according to guidelines or standard. Okay, so that's I think that is the bit where we can say that there's a bit of laxity on the part of government, because government is the one that's supposed to supervise everything that has to do with health. And by government, I'm not referring to a particular person, but the structure that they have in place. The Ministry of Health at federal level, working with the Ministry of Health at state level, working with the public health development agencies, at within every state and local governments, as the case may be. So I would say that they are trying, okay, but they need to do more. And by more, to be specific, there has to be increased funding, okay, and they need to beforehand determine what the funding is going to be used for. The funding should be used to revamp, renovate, improve, and equip existing facilities, hospitals, clinics, health centers alike, right? And then they should also look into personnel, okay? You need to employ people that will do the work. So, and funding will affect that, as a matter of fact. So that's why I talk about increasing funding, because it is with funding that they will pay salaries, for example. Okay, and we should, I think, also they should involve people who are into promoting health-related programs that would basically get the public to participate more in existing and also even providing health services, that are already available. Almost every single day we do amazing stuff, okay? And we have free doctors, right? And the free doctors happened mainly because of the recent administration, okay? The last employment, okay? And so they were retained, which is a good thing, because otherwise I would have been alone. And that's one of the challenges that we face here in Dwellers Function. We've had cause to individually develop ourselves to the point that we are able to beat our chests and say that we can be the reliable last bus stop for a patient, so that when a patient comes here, we know a patient is going to be treated and rehabilitated, completely. So there will be no room for probably referral. Okay, so we've had instances like that. Now, even though we are very poorly equipped, we have been able to do some really cool things, despite being resource challenged. Resource challenged in the sense that we a lot of times lack certain equipment. Let's say, for example, even surgical equipment, to be able to mediate certain interventions. All right, we have had to improvise from time to time, and generally we have stolen the confidence. We have rather the confidence of the public, and it is because of some of the things I've encountered, some of the patients I've been able to attend to using my skill and knowledge and access to guidelines, things like that. I do not hesitate to recommend to anybody in the country to visit a general hospital. Okay, because here I am, Ekerete in Pangshin, doing some really cool stuff, and I believe that there is also somebody else like me somewhere. In Plateau State, scattered across all the general hospitals are quite skilled and knowledgeable doctors. So if we have this in Plateau State, I should think there will be in Nasarawa State. I should think there will be in Cross River State. I should think there will be in Adamawa State. in all honesty, we cannot predict the future. I mean, there was a time, if we look back, there was a time that kind of thing happened. But Obasanjo was president. And around 2001, 2002, he enacted policies. By 2004, 2005, we had people coming back to Nigeria. Now, if you had asked someone in 1999, hey, what's the future? They would say, people are leaving Nigeria. God, they've just escaped a dictatorship of Abacha and, Abdul Salami, Jesus. Democracy is coming, but would the military allow us? Oh, no. People were leaving. So it looked hopeless. But it was the same period that we had telecommunications becoming available and affordable, okay, to people. So I wouldn't say that the future is bad as against what a lot of people would say. I am here, and with a little convincing, there are other people that can stay, right? I'm here because I want to see a better Nigeria now, not in the future, because the future will begin from today, from now. I have access to make recommendations to government, being the head of this facility, okay? So we have that. And being a creative mind, innovative mind, and all of that. And then having a responsive boss at the helm of affairs in the HND. We've had a lot of, tete-a-tete that we know will move the health services delivery in Plateau State forward. So, am I hopeful for the future in Plateau State? Yes, I am actually, okay? Because the current governor, Caleb Mutfwan, is very much interested in health. In fact, to prove it, he has kickstarted some of the abandoned renovations in hospitals. So 2 weeks ago, we had people coming in here to reassess what was abandoned, and they will start, right? So we have this happening. Why? Because people like us stayed back and to contribute our quota and to communicate some of the challenges that we keep facing or that we are facing to our bosses. Our bosses communicate to government. Government being receptive is taking steps rather to bring these things to pass. So you see, the future is not hopeless because we have people, we currently have very good minds in places of authority and significance in healthcare in Plateau State. Now, I cannot speak for other states. I'm currently in Plateau State, so I'm speaking for Plateau State. But I want to believe that just like what has started happening here, it would be ingenious to think that it will only happen in Plateau State. So I know that it could also happen in other states and maybe also spread even across the country. So no, the future is not hopeless. The future is hopeful. And maybe we should begin to preach and talk more about that and also talk about steps that we are making personally to see to it that we can get to the future that we want. I want there to be a future where you have a doctor, a passionate, diligent doctor exists. By a passionate, diligent doctor, I mean many passionate, diligent doctors exist in general hospitals across the country, in teaching hospitals across the country, in private hospitals across the country. And if we don't get the word out there, maybe that person, that one doctor who is probably thinking of Japan, discouraged. He is not trying to Japan because of maybe he's looking for money. Probably Japan because he's giving up on the situation of things around him. So he might just get inspired to push for change, because the change that we're currently experiencing in Plateau State, or that we will begin to see in Plateau State, are changes that we have pushed for. They didn't just fall from the sky. We only need to adjust our mindset. I'm not talking about adjusting our mindsets and accepting a delusion, but adjusting our mindsets and taking deliberate actions that we think, and in some cases know, will bring about what we want to see. Okay? If I was abroad, for example, there will be no doctor to see a patient in Panshin. I'm using that as, it's just a hypothetical, right? So if I wanted a doctor in Panshin, being a doctor myself, shouldn't I make myself available in Panshin General Hospital? Now, say you're an engineer, you're a genius computer engineer. Oh, you can program, write stuff. And of course, there's hunger in the land and all that. But if you think that that activity that you can perform should be done to make something happen. However, you are in faraway Australia. I'm sorry. Who is going to do it? Nobody's going to do that. So, in as much as things look very bad and, there's a lot of pain and frustration, to come out of the frustration is not going to just happen. There has to be people, persons, groups of persons coming together to bring about the collective dream of what they want for that society. And I think that one person can inspire another person and inspire another person, and then they as a group can inspire more people and even groups, to bring about the future that we want for Nigeria. And I have a good number of friends who, even though had the opportunity and still have the opportunity to leave Nigeria and seek out so-called greener pastures, they stay. And I know that they are deliberately contributing, to bring about the future in Nigeria that they want to see. I have to say that this came as a very big surprise. I am practically a nobody. I don't know what I might have done to deserve this honor, but I don't take it lightly. I appreciate you guys. I thank you for the honor you have bestowed on me, and I do sincerely wish you, all and only, good things as you move on. Thank you very much.